Thank you very much. I appreciate the opportunity to share a little bit about a huge program initiative that the city has instituted and some early successes that we wanted to outline with the goal of hoping that other folks could follow the lead in regards to having help with our police and law enforcement individuals related to mental health. As it was said, I'm Chuck Warbington. I'm the city manager for the city of Lawrenceville. I've been the city manager now for 6 years. And I'm a native of Gwinnett. And I also think we also have our mayor and council on the call as well. Mayor Steele, Council Member Martin, Jones, Thompson, and Taylor Crawford. Those elected officials are the ones that are really on the front lines of initially putting this forward and it being a success in our community. And then finally, I want to thank GMA for continuing this call to all the cities. This is helpful, even through the COVID times, and then now the topics. I appreciate GMA for continuing this. These calls are very helpful. I've tried to tune in as much as I can. So with that said, I'm going to go ahead and share my screen and get into our presentation. Just making sure my screen is being shared.
It is, Chuck.
Okay, I'll move right on. So the presentation today is about our community response program in the police department. And to kind of give a little context, because each city is different, I wanted to kind of outline a few demographics just so you can see how your city relates to our city, and then if this is a program that could be scaled up or scaled down. So that's the main reason for providing this. We're the second oldest city in Metro Atlanta. We were chartered in 1821, and as you'll see by my presentation, we're selling our 200th birthday as of December of last year. So we're going to celebrate all last year and also this year. Our population is just over 30,000. However, our population increases up to almost 100,000 during the day, mainly because we're the home of Georgia Gwinnett College, Northside Hospital, Gwinnett County Government, Viewpoint Health, and Summit Ridge Mental Health Center, amongst others. So we have a population that changes over from the night into the day just because of being the county seat of Gwinnett County, which is, as many of you know, is just under 1 million residents. I state that because as the county seat, you have a lot of the social services, the healthcare, the county jail is in our city, and that brings with it a variety of things that we have to deal with that other cities may not have to deal with. So again, I wanted to put this all in context as you think about if this is a program that would work well for your city. Our general fund budget is just over 41 million. That's our budget that's being proposed in fiscal year 2023. We have 300 employees. And we have a police department budget of just over 13 million, again, for next year, with 80 sworn police officers, which is a 2.7 per 1,000 residents. In 2021, our police department had 85,000 police calls of service, and really right at 19,000 were crime-related calls. And you'll hear these be very important as we get into some stats and some successes related to these items. So again, putting this all in context with this program, whether you fit under the 30,000 mark or over, this was important to kind of share what our city is made up of in our pilot program that we have started here with our police department. Now, as we go into the further into the presentation, when we talk about our cities, and I'll do this as a city manager, this is what we want to talk about. This is our downtown area, right off the historic square in our downtown. We're very proud of it. It's sparkly, as you can see with the pictures. It's, economic development. Every type of brochure that you have out of the city, you're going to see a picture of this in our city. And that's something we're very proud of. But the real story is we see almost on a daily basis across our nation and across even in our cities, is this is what we see on the news. You have police responding to a scene, whether a crime related or a shooting or things like that. And so that's what we are going to talk about today, rolling up our sleeves of how do we get into our community so we have less and less of these pictures that you see on the evening news. We started a program in the city in 2016 when I started with community engagement. And these are the types of pictures that we are trying to get out into our community, where we're out in the community. Our police academy, as you see there, we recently had a community award, and changing the face of the police and being out in our community. So this is part of our community engagement program, and the program that is expanded, as we'll hear about in just a second, builds upon these pictures that you see here. Law enforcement in today's world, this is kind of a general picture, a guy writing a speeding ticket. In this case, it looks like he's got a bottle in his hand, so it may be a DUI, but in today's world, police act as caretakers. They're peacemakers. They act as emergency medical, children's services, social workers, counselors, arbiters, and then really law enforcement as law enforcers as well. So the job description of a police officer has expanded really over the past decade to 2 decades in our community, because everything falls on our police department. You could probably say the same thing with our teachers in our school system, of how more and more is being placed at the feet of our teachers. And you see that with our police officers as well as they go into the community. As we begin to transition into talking about mental health and mental illness, I found this, this document from 2020, and I wanted to point out the 3 items here where it says 1 in 4 of all fatal police encounters deal with folks with, that are having a severe mental health illness. 1 in 5 of all our jail and prison inmates, again, deal with people with severe mental illness, and also 1 in 10 of all law enforcement responses deal with this. We are beginning to see this in our city, really in the probably the 2005, 2010, and it incrementally went up. But as we reached in 2018, we started seeing a significant increase. So going back over the past 4 years, we've had a 50% increase of service calls by our police department dealing with emotionally disturbed individuals. Just last year, and then obviously I think a lot of this is related to COVID, we had a 25% increase. So as we started to see this increase in 2019, 2020, we started a conversation with the police department of possibly researching and looking at a co-responder program that to specifically address this issue. Now, if you Google co-responder, this is not anything new. It's nationally, but as you see the national definition, it's a specifically trained officer and a mental health crisis worker. They respond together to address a mental health call. And so that's generally, if you look at how the nationwide program works, that's what it looks at. But a major part of that is a police department effectively implements this program. It can reduce service calls, incarcerations, and recidivism significantly. And I underline effectively implement because what we've seen with the research is you got to have buy-in at all levels. You got to have buy-in from mayor and council. They got to understand it, and they got to understand that this is a different way of addressing policing in your community. You got to have buy-in from the police department. You got to have buy-in from the community. And so if you don't have buy-in and everybody understands this type of a program, you don't effectively implement it, and you can see some good examples across the nation and also some bad ones across the nation as well. Our co-responder program was developed, funded, and it was implemented in 18 months. And we used a local mental health center to provide the behavioral clinicians. That was important because we wanted the professionals to onboard and train and credential these clinicians. And we use Viewpoint Health, which is actually headquartered here in the city of Lawrenceville next to Northside Hospital, to partner within this program. So why is Lawrenceville's co-responder program different than what you might see nationwide? The co-response program historically refers to a system where mental health clinicians respond to calls for service that involve just mental illness. Well, what we have done in the city is we've created a Lawrenceville community response team that works under our community engagement police department division, and it responds to individuals in crisis. And the city defines crisis very broadly, so that's how we are different. So when you think about crisis, this obviously, this individual that you see on the screen, he's going through a crisis. It could be that's generally when we talk about somebody in crisis, that's what we see. But there's so many levels to crisis in our community. You have a family crisis. You could have a housing crisis where somebody may have lost their home, or it could be homeless. There's emotional crisis, as you see this individual on the screen there. PTSD could be a health crisis. They could be having an issue related to a long-standing health issue they've had individually or even in their family. Community violence, employment crisis, pandemic, personal crisis. So we have broadly defined a crisis in our city to respond when we respond to calls, more than just mental health. And a lot of times folks would say these are some mental illnesses related to some of these items as well. But that's very important as you begin to see how our program works in our city. So the structure is, this falls under our community engagement division in the police department. This is a pilot program that we wanted to see how it worked. It started in July 1st of last year. We have 2 behavioral health clinicians, and these individuals are embedded in our police department. They're not on call. They're not at Viewpoint. They're actually in the police department headquarters, and they ride with police officers, and they're dispatched for officers on crisis-related calls. Now, I'm going to pause here. I want to go back to that word crisis, because for the city of Lawrenceville, we have our own 911 system. And so our 911 communications officers, before they dispatch a call, they're asking a variety of questions, and they are able to label this as a crisis-related call. And we label it, and we determine that very early on. So as our officers and the clinicians go out, they know exactly what they're referring to. The 2 clinicians are scheduled 7 days a week. At the times where we get our most calls, they have overlapping schedules. So in our most busy times, they will overlap their schedule, and they're on duty providing the support to the Lawrenceville Police Department. Their 2 main duties are around the intensive response during the crisis and helping individuals. And frankly, they are able to do an initial assessment and provide immediate direction on what that needs to be. It could be a 1013 where they need to be taken to a mental health center immediately, or it could be a housing issue, and we can direct those individuals and help them get to that standpoint. The funding of this is right at $60,000 per clinician for a total of $120,000 a year. And our initial investment into this program is we're using ARPA funds to fund this program. So I want to spend a little bit of time on this slide, because I think this really tells the story. So as I mentioned, we started this program in July 1st of 2021, and the CRT column that you see that is our community response team, made up of two clinicians and a couple of police officers in our community engagement sworn officers division. The other one is just straight patrol. And so in the 6 months that we had this in place of July, the community response team responded to 263 calls that were crisis calls. Because this is an initial program and it's not large enough to respond to all calls, our patrol officers responded to just over 2,500. So the neat thing about this is what we're seeing with the initial data is, out of those 263 calls by the community response team, only 4 of those individuals were arrested, went to jail. The patrol that responded to crisis calls, what we refer to as a crisis call, 317 of those individuals went to jail and they were arrested. Obviously a huge difference. If you want to look at our overall number, our average of every crime-related call is right at 4.5%, and I have that footnote at the bottom there. And so what we're seeing, even on crisis calls, there's an uptick of folks, if we don't have the mental health for folks going along, of increasing. So I did some quick numbers on that. 12% of 263, if we didn't have this team in place, that would be an additional 32 arrests over that 6 months. If you look at the other way, if we had a fully funded program where every crisis call was being responded to with a CRT team, we would have reduced in a 6-month period 291 arrests just using these percentages. So, you know, this gives us some really good data up front with the success of this program, and it has really help the overall program in our community to making sure that we're not taking people to jail that don't need to be in jail, but they need help. With that said, I'm going to go through 4 case examples. I've taken out the names, but I think these documents and these charts speak for themselves. As you'll see, the red dotted line or the orange dotted line is when we actually started a team going to this individual, and you'll see it at different places. But we had 16 pre-CRT responses to this individual with schizophrenia and an SA disorder. Once we had this team respond to this individual, we had 3 calls, and this individual now has been placed in a mental health facility where he is being helped, and we have not had any additional calls. Huge success. This is another participant that again was schizophrenia and an SA disorder. As you can see here, we had started out 7 calls in the month of July. We had the team respond to this individual in October, and we have not had a single call from this individual since this team has actually went and addressed this particular individual. And I think this individual actually was assigned and got help from his family, which he had been out of touch with. Our crisis response team was able to address that. This is one where we had 24 pre-CRT. This was in September when we had the team address this individual. We had a little bit of an uptick back and forth because we had to find the right services that this individual needed. But once we found that in late November, we have not heard from this individual from a calls for service since December. And then I want to end with this individual where I think this chart tells the first story. We started this community response team the day we started because, as you can see, in the month of April, we responded to this individual 21 times. Almost every single day we were getting a call from this individual, and it was obviously related to mental health, bipolar, and TBI. And once we got this individual help, as you see here in August and September, we had a little bit of an uptick when he got back out, and then we ended up finding a secure place, a long-term facility for this individual. And again, we haven't heard from this individual as well. So this is, again, just 6 months of data with several individuals. So we're seeing some initial huge success. My counsel who is on the call, they already know this. We have submitted our budget to request an additional community engagement officer to work in that program. That'll be a sworn officer. And we're going to add an additional behavioral health clinician as well. There's been some also recent changes with the state law that I'm sure that we could discuss in greater length that have actually helped policing related to mental health that actually is going to help even our program as well. And I'm happy to have some of those discussions. I'm not a full expert on all those, but from what my police department tells me, it is the state law that was recently passed was really going to be good for all the communities in the state of Georgia. So with that, I will end my presentation and ask for if there's any questions or clarifications I need to make.
Thank you, Chuck. And at this time, we'll open it up to the members on the call to see if you all have any questions. You can either enter them in the chat or unmute yourself and ask the question.
Hey, Chuck, this is Brian Wallace at GMA. What's the response been with the police department itself and the officers?
So that's a great question. I admit to say that earlier when I talked about buy-in. You've got to have your police department buy-in as well. And that was one of the discussions I had with our police leadership at the time, wanted to make sure, and we used some focus groups within the police department to help them understand this is not a defunding of the police department initiative. This is a support system to the police department. And this has actually worked out so well that we actually have police officers who come in on a daily basis at roll call and say, no, I want the individual to ride with me today. And so they, we almost think we're going to have to do a lottery system to help these officers or these clinicians to ride with some of the officers. And so it was an education, it was communication, and our police force embraced it. And I think the results speak for themselves. Even when you ask the police officers, they point to that one initiative and having these officers as being one of the biggest positive things that's happening in our community in regards to policing today. Good question.
Chuck, to follow up on that, I would imagine that because you have had this positive result, that it has freed up police officers to handle other duties under their job descriptions. Do you have other metrics that show how that free time, they're not going to the same person 20, 30 times? Do you have other metrics that help show that they've been able to address other issues?
Yeah, we do, and that's one that actually we've got a variety of metrics that I want to wait till we have a year's worth of data. Having this 6 months data snapshot told me that we're on to something positive. I want to have a year's amount of data and then look at how our police officers, because this is all new, so there's some kinks in it related to we still having officers respond to various places that we may not necessarily need to if the clinician is there and handling the situation. So those metrics will be forthcoming in the month of July, August of next year, because I think the amount of time it saves with police officers being on the call for service, and then also eliminating calls just in general, as you saw those 4 examples, I think that's going to be a very positive metric that we're going to see with a year's amount of service moving forward.
I got a question through a private chat message asking, are the health clinicians full-time city employees?
It's a great question. They're contract employees with Viewpoint Health. So that was a discussion that we had at length with our legal department because we wanted the liability and the training and the onboarding and the responsibility of a clinician to be with the professionals that know how to deal with those individuals. So yes, that was they're a contract employee from Viewpoint Health. We have an agreement with Viewpoint Health, and it has all the standard type of agreements you would have with a vendor. And they are considered to be a contract employee for the city of Lawrenceville.
How did you select Viewpoint Health? How did you all come to that?
That was very easy for us. Viewpoint Health is the premier mental health provider in Gwinnett County. So anybody that works in Gwinnett County knows Viewpoint Health. They do a lot of partnership with Gwinnett County government as well. So they're kind of the go-to mental health industry or center for Gwinnett County overall. They happen to be headquartered here in our city next to Northside Hospital. So it was easy for us. I know in other communities it may not be as easy. But for us, that was a very easy selection for us.
Chuck, if you're a city that doesn't have a police department, is there any of this that can translate? It's obviously an awesome program.
I think it really, the responsibility needs to be on the jurisdiction that provides policing. I think, if a city doesn't have a police department, maybe the request is, hey, our city will pay for these clinicians if you have these clinicians in our city. That could be a possible way. I don't know of a pilot program that's out there, but that would be one possible way that you could go to, in your case, DeKalb County, and say, we'll provide funding for these clinicians, but they need to be housed and embedded in the police department as for calls in the city of Tucker.
Gotcha, Tucker Precinct. Thank you.
Hey, Chuck, Demetrius calls a GMA. Lawrenceville has been a pretty exemplary in implementing this model. Have other cities reached out to you all about your co-response units?
They have. We've had multiple cities, and I failed to mention, actually, Gwinnett County is actually doing this same type of initiative at their precinct level. So that was very important when I went through the demographics of Gwinnett County, or of the city, because this is a program that can be scaled large or small, depending on the size of your city. And so Gwinnett County has taken this to a precinct level. I think the city of Norcross possibly is looking at this program, may have already started the implementation process. If anybody's on here from Norcross, I think the city of Lilburn as well. We haven't really gotten the word out that this is available and this is what we're doing. But I'm happy to speak with any city to offer any type of words of wisdom and even contracts for that matter of how that works, if any city is interested in that. My
Thanks.
contact information's on the screen.
Awesome.
Chuck, Brian Wallace again, Jim. I have one more question. Is there any special skill set with the folks that are going out with your officers that you all needed or felt that they needed to have that may be beyond just kind of their educational background?
So that's another great question. We have actually, even though we started with 2, we had a changeover with one of the clinicians. One of the clinicians just didn't really work well in the police environment. And so that would be one. I do think it takes a special individual if you're with the police and you're going to a police call. Obviously, the police officer stabilizes the situation and addresses it, and then the clinician goes in. Outside of that, we leave that up to the professionals of how they are educated, how they are registered, and their continuing education as well. And so that was part of our discussion of making sure we went with a reputable mental health group that would provide those individuals to us. And so we don't really give them anything other than we need to make sure they understand you're working in a police environment and you got to work well in that type of a situation.
Chuck, I have a question for you. As far as your police department, can you give us the size of your police department?
Yeah, we have 80 sworn police officers.
Okay.
I want to say the total department, including all the 911 dispatchers, is right at, I think, 105 to 110. That's
Okay.
1/3 of our city employees of 300. As I said on an earlier slide, that's right at 2.7 per 1,000 residents. So we're kind of above where I think the national average for policing is right at 2.6, 2.7. So we're right at that. But 80 sworn police officers, and then if we add this additional one in the next budget, we'll be right at 181 sworn officers. And we're like everybody else. We are dealing with vacancies. I think that changes on a daily basis. We have various folks in the hopper, but we're right at, I think we're 8 vacancies right now with 5 ready to be hired going through the background check. So we're going to hopefully be back up to our normal level very soon.
Thank you.
Chuck, you talked about the positive feedback you've gotten from the law enforcement professionals. Have you gotten any feedback from your municipal court professionals?
We haven't. That's an interesting one. I'll add that to the question when we look at the metrics. Obviously we've got less folks going to jail, so I think Gwinnett County would be very, very excited about that since they handle that, the jail side of that. But I'm going to add that to my list to see what the staff at the court and also the municipal judge, if he's seen any impact as well. It's a good question.
Thanks. Are there any other questions for Chuck?
Chuck, who is a good contact person that we could contact with Lawrenceville to get additional information?
So I'll put my contact back up on the screen so you'll see it. Start with me, and then I can get you in touch with the community engagement officer that's over this program, and he'll talk 2 or 3 hours about this program. So let me put that back up here. So feel free to drop me an email or give me a call, and then I can give you direction there.
Thank you again, Chuck. That was a fantastic presentation. It shows that, the actions that, I got to say, Brian and I were actually texting, and we really appreciate your counsel being on this call as well. I mean, it shows the support that you and your law enforcement professionals have for this initiative. So,
well, as we all know, it starts with leadership, and it starts with counsel, and they have to be the one that buys into that, and then also have to be the one to fund it. And so that's they're the ones that drive this, and we're the ones that get to implement the program into the community. And so I appreciate you saying that. We have a great council here.